Welcome to journalists across the region who are joining us on World Health Day. Each year on 7th April, we use World Health Day to highlight an issue on which we need to work to achieve better health. During the last 2 years of COVID-19, we have learned a lot, especially that when health is at risk, everything's at risk. Health and people's lives and the broader well-being of the society are inextricably linked. Our health and well-being are also closely linked with the planet's health. The UN Secretary General labeled the report of the Intergovernmental Panel on Climate Change, IPCC report, as a code red for humanity. It is also a code red for health, because climate change affects health in many different ways. And if we don't take action today, we are risking our health in the future. And that is why the theme of this year's World Health Day is Our Planet, Our Health, which highlights the interconnectedness between our own health and the health of our planet. There's no denying that climate change is one of the biggest crises facing humanity today. It is also a health crisis. Countries and areas in the regions, particularly Pacific Islands, are on the front lines. Changes in rainfall patterns, rising sea levels, and increasing frequency and severity of tropical storms threatens access to fresh water, reduce the lands suitable for growing healthy food, and increase the risk of waterborne, vector-borne, and foodborne diseases. Extreme weather events such as drought, heavy waves, typhoons, floods, and wildfires are affecting people's health in various parts of the region. And in addition to that, global warming consequence of burning fossil fuels, the air pollution it generates poses a huge direct threat to health. It is very clear. The time to act is now. There's no single big solution, but the governments, business, communities, and the individuals all have a responsibility to take actions to reduce climate change and environmental degradations, and thereby their impact on health. We must tackle this crisis together. The pandemic has also been a stark reminder of the importance of strong, resilient health systems. As we chart out way out of the current public health emergency, with the world's attention still on health, we in the health sector have an opportunity to contribute in two key areas. First, by building sustainable climate resilient health system, and second, by working with other sectors, using our voice to help strengthen the argument for broader actions to address climate change and environmental harm. While the health sector must contend with many of the problems caused by climate and environmental changes, it has relatively little control over the factors that cause these problems. Clearly, the sector outside of health are in the position to take the lead in reducing carbon emissions, but in the health sector, we can help them to understand or work together with them to understand that there are important co-benefits for health and for other sectors, and in doing so and in acting together. For example, building cities which promote active transport, encourage people to walk or cycle instead of driving, can lower air pollution with the benefits of respiratory and cardiovascular health. This would also result in higher levels of physical activities and helping to reduce the burden of non-communicable diseases. Now, in addition to these points about World Health Day, I also wanted to take the opportunity to take this opportunity of this press conference to provide an update of COVID-19. Let's begin with an overview of key numbers of the Western Pacific from our Director of Health Security Emergency, Dr. Tunde Olovakore. Tunde, please.
Thank you very much, Dr. Kasai. So I'm going to, thank you, distinguished guests, members of the media, good morning. So I'll share with you the COVID-19 situation in the WHO Western Pacific region. If we go to the next slide, please. So the next slide gives you an overview of the global situation, and you will see that this is dated as of yesterday, and so the information is accurate up until then. Now, what we can see is that on the left-hand side, so those of you who are familiar with this presentation, you will see on the left-hand side is the global picture, and each of those different colors represents a specific WHO region. And you will also see that what is the purple color, if you can see the purple color, which represents our region, is quite prominent towards the end, and I will touch upon that on the next slide. But on the right-hand side, you can see the various countries globally which are contributing the most to the upsurge in numbers that we are seeing. And this is driven mainly by Omicron across the world. And if we move to the next slide, please. So in the next slide, this focuses now or drills down into the Western Pacific region. And again, on the left-hand side, you can see the overall picture in our region. You can see that in the last several weeks, we have experienced a upsurge or an uptick in cases, which has been quite dramatic compared to our previous surges. And this is mainly because of the Overcrown variant of the SARS-CoV-2 virus, which is much more highly transmissible than the previous variants that we have seen. And on the right-hand side, you can see the various countries which are in the top 10 within our region. And a number of those are experiencing those surges in as a result of Omicron. Some are seeing a reduction in their surge now as they've gained more control and are being able to suppress transmission as a result of implementing a number of measures. And again, I will touch on those a little bit later. And we also have a number of our countries, of course, which you will not see on this particular slide. And those are the countries which are still yet to experience the encroachment of the virus in their country, and those countries are preparing to be ready to respond should the virus actually arrive when it does. So on the next slide, just give you an update for you on the key characteristics of the Omicron variant, which I'm sure most of you are familiar with by now, as this variant has been around for a little while. But if we go to the next slide, now the next slide talks about this recombinant forms of SARS-CoV-2 virus. And when we talk about recombination, what we're emphasizing is that there are two different virus strains which infect the same cell simultaneously and exchange genes between them. And so this exchange of genes may be similar in somewhat to mutation, but it is not unexpected given the level of transmission that we are witnessing across the region as well as globally. This is not unexpected, and we should really be maintaining our awareness and alertness for this to happen, and hence we are implementing a global, a regional genome sequencing surveillance network. The next slide, so this slide shows you the surges that we will see. We should anticipate surges. And in order to do that, what we are seeing as well is that our member states are moving from what used to be a contain and suppress approach to SARS-CoV-2 to a suppress and live with it approach to SARS-CoV-2. This, of course, does not mean that we give up on maintaining our alertness and our awareness and our ability to continue to prepare and respond, because there is the potential, as we have seen already, for recombination, and a recombinant variant may be more severe than what we are currently dealing with. And so this is very, very important. And so any actions that we take now should improve our readiness to deal with what we are currently responding to, as well as to prepare for the future. And my last slide here is just a number of takeaway messages for you with regards to SARS-CoV-2 and our situation. So we will anticipate future surges, because this virus, as long as it is somewhere in the world, it will continue to mutate, it will continue to evolve, and may continue to pose a threat to us. The recombinants that we have seen so far, variants that we are monitoring and continue to monitor, but currently there is no evidence of change compared to Omicron parent virus, and so therefore any measures that we are currently taking are effective as far as we know at this time. Member states moving from this acute pandemic response to sustained management of COVID-19, they're required to use the 5 key tools which were illustrated in the previous slide, and also the 3 pillars as a package, and therefore look at ensuring system change and the system adaptability. And so as we move forward from these 2 phases into this new phase, the emphasis now should be continue to learn and improve so that our systems maintain their alertness, government preparedness for potential surges, vaccination. We need to prioritize vaccination, especially for those who are most vulnerable, those who are at the greatest risk of infection, and this includes the elderly, the immunocompromised, as well as healthcare workers and other frontline workers. And we also now need to ensure that individuals take particular responsibility, as well as owners of various settings. And when I say settings, I'm referring to schools, healthcare facilities, factories, and businesses. And so we all have a part to play in this. And so therefore, I would suggest that if we want to suppress transmission at this stage, we need to work together in order to be able to do that. Thank you very much. I'll be back to you.
Thank you very much, Tunde. As you heard, some countries in our regions are now experiencing large Omicron drive surges, and others have passed their Omicrons, but continue to actively monitor and respond. And some Pacific Island countries and areas are dealing with their first community outbreaks, while others are still preparing for COVID's arrival. We know that the virus will not disappear soon, but we also know that working together, we can end this public health emergency. We have learned a lot over the past 2 years, including through Delta and Omicron surges, about how to protect the vulnerable, maintain the functioning of the health system, and adapt measures to enable societies and economies to function. Population-based measures are being eased in many places, but this does not mean countries are giving up on controlling COVID-19. Rather, it reflects that many countries are transitioning away from society-wide containment measures to an approach aimed at sustainably manage COVID-19 over the long term. We are able to do this because countries and areas in our region have used their response to Omicron to further develop and strengthen their system for suppressing transmissions of the virus. And we continue to learn from these experiences to improve and refine strategies for suppressing transmissions while resuming most normal social and economic activities. As a part of this approach, government, business, and communities and individuals all still have important and specific roles to play in contributing to the broader goal of suppressing transmission especially to protect the vulnerable so that the societies can live with COVID-19. Now, government needs to go the last mile to reach every vulnerable persons with vaccines and refine the surveillance for the effective decision-making and ensure the health systems are arranged in a way to provide the services to those who need them and clearly communicate with business communities and individuals about what they need to know so that they can take most appropriate actions. And decision makers who are responsible for workplace, business, events, and other gatherings and schools need to take actions to keep people in those settings safe. And at this stage in the pandemic, it is just as important as ever that as individuals, we all keep making smart choices and take the right actions to help suppress transmission and protect the vulnerable people around us. This means, for example, getting vaccinated and boosted as soon as it's our turn, and wearing masks in high-risk settings or when with the vulnerable people around you, and physically distancing if necessary, and to manage the risk in our own context. If we all do this, we can control transmission, reducing opportunities for new and more dangerous variants to emerge, protecting the most vulnerable people around us, and get back to living the lives that we all want.